And welcome to the Dr. Bob Show. Did you know that there's one single, simple blood test that could save your life? It's an A1C. What's an A1C? We'll be talking about that and how simple it is to get a simple, inexpensive blood test that could save your life. It will diagnose pre-diabetes, a condition where you don't quite have diabetes, but you're going to get it, and we can perhaps keep that from occurring by simple activities and change of lifestyle. When we get pre-diabetes, there's things that we always talk about on the Dr. Bob Show: exercise, sleep, socialization, that can keep you healthy. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking with our guest, Dr. Amit Vora, board certified in endocrinology, and he deals with prediabetes, A1C, and some new devices, new technology that will help you and your doctor keep you alive. A lot of information for you. You're going to love this show. Stay tuned. We're talking with Dr. Amit Vora, board certified endocrinologist, and we're going to be learning that one blood test that could save your life. 95 million people in the United States have pre-diabetes. 85 million of those don't even know they've got it. And yet the problem continues behind the scenes. Amit, welcome to the Dr. Bob Show.
Thank you for having me again. Thank you, sir.
You know, I reviewed the last show when you were on. I was absolutely so impressed with the information that you gave and also some of the awards that you have received. I want to mention one of them. For 2 straight years at Cook County Hospital, you got the Humanitarian Award. That means you're the kind of person that we want to be a physician, one who loves his patient and loves taking care of his patient. So I take my hat off, I give hugs through the air because of that honor. Now, let's get to what is that one blood test and what is the definition of diabetes and why is diabetes and pre-diabetes different? I've thrown out a lot of questions.
The blood test, as you said, is the simple hemoglobin A1C test.
And that sounds like a crazy word, A1C. What does that mean?
The A1C test, in simple words, is kind of like a report card on the glucose levels for the past 3 months.
So you can't cheat and not eat for 3 days before you go see the doctor.
That's a good point, yes.
Report card.
3-month report card that shows the average glucose excursion. So it doesn't matter what time of the day it's done. They could be at the doctor's office in the afternoon, they could be fasting. It still captures the correct information to help diagnose diabetes or pre-diabetes, like you said.
So what are the values for pre-diabetes and for diabetes with an A1C report card?
Yes, sir. The pre-diabetes number, so a normal hemoglobin A1C is something less than 5.7. 5.8 to 6.4 is knocking on the door, the pre-diabetes.
And that's the one where you silently, people can go on and have the problems that damage what part of the body?
The eyes, the kidneys, the nerves. We know that the damage starts early, which is exactly why we want to try and turn the tide and prevent diabetes. When it gets to 6.5 is the real diagnosis of type 2 diabetes.
So A1C, 6.5, you got the diabetes, but beforehand is really the thing that we're interested in getting the primary care doctor to order?
the hemoglobin A1C test so that we can turn the tide. Tennessee, Dr. Bob, numbers are even more concerning. We're almost 1 in 5 for diabetes. And for each person that has type 2 diabetes, we are learning that there's 3 more people with prediabetes. We're also learning that these messages, increasing awareness in our community of screening and of diabetes and prediabetes, is helping slowing down the tide. We think, slowing down the number of people that are being diagnosed. So this is helping our community.
So in East Tennessee,
yes, sir,
we have the greatest people in the world. They're the kindest and most caring, but they've got some bad problems too. They're overweight and they don't exercise. Is that what's going on?
You know, I don't know. I've been here 20 years. I agree. I love the community, which is why I'm here. But I think part of it could be the food. Part of it is maybe not staying active. But we can learn better nutrition, being mindful of carbohydrates, increasing protein intake, increasing fiber, healthy proteins, staying active. The recommendation for activity for anybody with diabetes is about 150 minutes per week. I don't think that's much. That's about 30 minutes or 40 minutes, 3 to 4 days a week.
So 3 to 4 days a week, that's pretty practical. I used to say 7 days a week and you got to do it. And my wife said, people are not going to do that 7 days a week, but they can do it 3 or 4 days a week. So what do you tell them to do? Get their tennis shoes and go out for a walk?
Any form of activity is better than none. I tell people if they love to walk, they can grab their spouse and go out for 30 minutes after dinner or before, or they could go to the gym. But it doesn't really matter how. Something that they love to do, something they can continue to do.
Yeah, and wouldn't that be a great way to be helping your body, is by doing activity that you like to do. So I wanted to go back, one thing you mentioned there. What's the difference between protein and carbohydrates, and why is that important?
Carbohydrates are what quickly increase glucose levels. And when it comes to carbohydrates,
give me an example of carbohydrate.
I tell all my patients, pizza, pasta, potatoes, white bread, soda, sweet tea.
And so those are things that we're attracted to, and probably for some reason the body is saying, we'll raise your blood sugar.
Yes.
Okay, so you got to learn to avoid that. Is that too difficult on people?
It's not that difficult, and I'm not asking everybody to become a saint and give up all carbohydrates. I think the recommendation is to have better quality carbohydrates, more protein, and less carbs, the better. So it's a balancing act, but it's just nourishing better.
Eat less, exercise more. We mentioned that on the last show. And what you're going to eat more of is a small amount of protein. How small? So
the carbohydrate intake can be 30 to 40 grams per day. Protein intake about a gram per kilo, so 50 to 70 grams of protein per day.
What would that be? I wouldn't know what 70 grams of protein is. Decacards.
Yeah.
Okay, so a decacard's that much hamburger. That doesn't seem like very much, but when you put a decacard of protein in your stomach, before just a few minutes, you actually feel full. Is that right?
Yeah, and you nourish yourself better.
Yeah. So, and what does carbohydrate do? If it goes to glucose, what happens to the insulin in that scenario?
So, the diabetes, the whole definition is either an increase in glucose because of a lack of insulin, an absolute lack, or there is insulin, but it's just not working well. So there is resistance to insulin.
So there's two things that can happen there because related to carbohydrate. So is there treatment for that?
There's ways to sensitize the body to insulin. There are treatments. It's easier sometimes said than done.
And that's what we're going to be talking about. How to regulate insulin, easier said than done. Now we're getting complicated. Let's see what we can do to make that less complicated. We're talking with Dr. Amit Vora, board-certified endocrinologist. We're talking about diabetes. We're talking about pre-diabetes. We're talking about the report card, which is a hemoglobin A1C. And then we started talking about protein and carbohydrates. Carbohydrates go to glucose. And we now know that that produces a hormone called
Insulin.
Tell me about insulin and why it's important.
So insulin is the gatekeeper that allows nourishment to enter into the cells.
That's a great way to describe it. That's really good. So it's a gatekeeper that says, okay, I'm giving you some energy, now the insulin is going to help us use it.
That's correct. And so if there's not enough insulin, or if the insulin is not working well, glucose hangs outside of the cell, but there's not enough inside.
How do you get it inside?
So this is where insulin or medicines that help sensitize the body, and there's a plethora of medicines. It's just an exciting time in diabetes care to be able to offer so many different options to help our patients with diabetes.
Is that going to help you regulate the blood sugar, which is the key, what we're talking about, the blood sugar that we're going to try and get under the cells? Is that the key?
That is the key.
So tell me about new technology that can help us measure what's going on. Sensors, receptors, CGMs, start it off.
Yes, sir. So it's, like you said, it's an exciting time to help to be able to use technology, advances in technology, that encourage, empower our patients with diabetes.
So the patient's going to be able to take part in this. Tell me how.
So these itsy bitsy, and I have a little show and tell, we can look at different sensors, but they basically give a continuous commentary on what is happening to the blood glucose levels.
So the report card, instead of every 6 weeks, comes every day, every minute of every day.
Exactly.
Show me one.
Well, here are a few of those, and this is one of the newest kids on the block. It is a Freestyle Libre sensor, size of 2 pennies. Of course, I used that analogy today with a youngster who said, "What is a penny?" But I have not seen one. I haven't seen a penny. But anyway, these are different sensors that what they do, Dr. Bob, is think of the pain that is involved in doing a finger stick for a glucose. It is my hope, it is my prayer that one day all our patients with diabetes or even pre-diabetes are wearing one of these pieces of technology that they can see real time what is happening to their blood glucose.
Is that possible?
It is here. It's not in the future. It is here now.
So show me that. So that's the sensor. Where do you put it? On an eyeball or on the chest or where?
So these different sensors can be put on the abdomen, on the skin
on the
here,
outside, on the skin.
on the skin or on the arm. But most insurances cover it. They're becoming less and less expensive. Anybody with diabetes who's on insulin can get one of those from their doctor, and they can see for themselves. Sometimes we don't want anybody else to tell us, don't eat this or don't do that. Even a well-meaning, loving spouse saying, "John, you shouldn't eat this." Well, it's best if it came from within. So if they saw what was happening to their blood glucose, and I tie this into even exercise. When they go to walk, they see that the blood glucose levels are going down.
So is it a monitor sort of thing? What is it? How do they see it?
Very good. Used to be, and there are still monitors available, but technology, Dr. Bob, is becoming so elegant, they're all available or show up on the phone. So you and I, all our patients can see what the blood glucose levels are in real time on the phone with most any of these sensors.
That's out of sight. So you've got a sensor that sends the information to your phone, and when you're walking downhill, uphill, you can say, hey, this is what's going on with my blood sugar right then.
That's right. And then to make it even better, technology, insulin pumps have been around for a long time.
Yeah.
But now, for the last 4 or 5 years, there are pumps that talk to the intelligence that comes from the sensor. So the moment the sensor says blood glucose levels are going up, insulin delivery goes up. The moment the blood sugar is going down, insulin decreases. The delivery of insulin decreases.
So it's really we've really got sort of a solution. So we've got something that's a sensor that says, aha, I can tell you what your blood sugar is at that second. We've got a recording device, and then to our cell phone, it tells us what it is. That information goes to a pump. What's a pump look like?
So pumps come in different sizes. This is one of the disposable small pumps that is good.
Can you pick that up? Are you
able
to?
Of course. So this is a pump that gets a cue 24/7 from a sensor. And I think back to the days when people still do, check their blood glucose 2 or 3 times a day.
Yeah.
And you know what I equate it to, Dr. Bob? If you and I were to drive a truck, but the window is only opened 3 times a day, or the pilot is driving a plane, and they only see through the window 3 times, would that be okay?
That wouldn't be okay at all.
But here we have continuous navigation. So this glucose information is not just 1 or 2 times a day, but it's all the time. So we know when the numbers are high or low. And that just empowers, that educates. It's not designed to make a person feel bad when the blood sugars are going up. It's just designed to teach. It's helping them be in control.
So I take it that education is a huge part here, because what you're telling me is, if I happen to go out and eat 3 baked potatoes that have a lot of starch in them and my blood sugar would go very high, that the machines would recognize that and would pump out extra insulin that would bring it back down to normal. Wouldn't that lead me to go astray?
Well,
I hope not.
It can, but it's not. These are technologies that help keep things under control. Yeah.
And so it continuously keeps it under control.
And if I may add, even if they're not on insulin, it still is helpful. So we talked about technology where a sensor and a pump work in tandem. But even if they're not on insulin, this is super valuable information.
Wow. So it can tell the guy that's a tennis pro who's running up and down using a lot of calories, that's got diabetes, that he's not exercising too much or that he needs some more sugar. Can a primary care physician who is not in a metropolitan setting, can he guide the information by getting your cell phone info to him and he regulate things out in the country?
Yes, sir.
And that's what we're going to be talking about when we come back. Can every doctor at any place or every patient empower themselves to regulate their own blood sugar? Will artificial intelligence do that for the doctor? This is getting big time. It can save my life and your life. You'll want to fascinating. I can't wait. We're talking with Dr. Amit Vora, and we're talking about diabetes, and we're talking about sensors and receptors, and where you, the patient, and your doctor can know continuously what your blood sugar is doing, and then the pump regulates that. Now, Amit, would you show me the power of the little sensors you've got in your right hand that are about the size of 2 pennies. So what can they do? What's their power?
This thing can be prescribed by anybody, any family doctor, any specialist, anywhere in the country. It can capture the information, which then can be viewed remotely anywhere else. And not only can the doctor, but their whole team, it could be the diabetes educator, it could be the nutritionist, they could look at that information and call our patients or make changes, educate them on what they need to do differently.
And what would that do as far as putting the United States where in the treatment of prediabetes or diabetes or living longer or getting rid of all this?
Now you've touched on a very sensitive but important mission statement.
Yeah.
When you said 90 million people, now this technology is not yet available for everybody who does not have diabetes. It is only for people who currently have diabetes and or are on insulin.
But let's say it was available for everybody. What would that mean?
I think we would be amazingly successful at turning the tide and reducing the number of people who get diagnosed with type 2 diabetes.
So
Big time.
How would that make us compare with European countries and South America and everywhere else?
I think this would be, in my opinion, is a relatively inexpensive intervention that can really change the trajectory of diabetes in the United States.
So if you, the viewer, can change the attitude of the payers where everybody that has prediabetes determined by A1C, the insurance company will want you to have that, and they'll want you to wear that, because if it knocks out diabetes, it knocks out a major cost that they're having to support. Bottom line, hemoglobin A1C, monitor, the size of 2 pennies. Have your insurance company pay for it. Talk to your doctor. Wave a green sign if you have to. But we need to get that available for you so that America will be leading the league, leading the world in its treatment of trying to get rid of diabetes. Let me go through that again. You have to talk to your doctor and your insurance companies and everybody that you can think about with a green sign, if you have to, waving up and down, saying, we want to be able to have a sensor. We've got prediabetes. It's going to kill us if you don't get this for us. You can get it done. And I hope it comes from the Dr. Bob Show, but more so from Dr. Vora, and more so because it's a way that we can make our people healthier and happier and live longer and do better. So what do you want to add to that? Tell me about the education.
I think when the first step in knowing what the problem is knowing what the problem is.
Yeah.
So having information is the key. If I find out, which I have a family history of diabetes, my dad has it, and so if I know that I'm flirting with it, I can make a change. I think people deserve to know. So having that information, they could talk to their doctor about going on medicines to prevent diabetes. They could make diet changes. They could eat better, sleep better, things that you've talked about for a while. So this is the first step in being informed.
And all of those things that we talk about, the exercise, sleeping well, the socialization, the laughter, all of those things fit with improving blood sugar along with the monitors. We can get rid of this disease the way I'm looking at it. And when that happens, it will be so good for the world. So with that in mind, one last word of advice for the public.
Diabetes can get old. It has its burden, it has its baggage, but there is hope. There is technology that will hopefully help our patients not feel dejected. I want people to understand that it is possible to live well with a chronic disease like diabetes.
Amit, Vora, you're a phenomenal teacher. And I want everyone to remember the things that we need to do will help your diabetes. Number one is exercise. You need to be exercising only 3 or 4 days a week. Hey, that's a piece of cake for what we've been talking about on the Dr. Bob Show. The more you exercise, the better you'll be. So remember that exercise is an important part of your health. Eating properly, well, that means less carbohydrates, less protein, but concentrate on eating protein and not eating carbohydrates. That's easy to do. Look at your plate and decide what you're going to eat, and eat less and exercise more. 7.5 hours sleep. And what does that mean? It means you just simply look at your alarm clock and you say, hey, I'm going to set it for 7.5 hours. And you go to bed and you wake up with 7.5 hours sleep. You'll feel better. You'll feel refreshed. The people around you will feel refreshed. You won't get as angry. You won't lose your cool if you'll do those things. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Find that loved one, laugh a lot, giggle, and you'll stay healthy.